In Chapter 14, we're going to continue on with the cardiovascular system and move on to the blood vessels, blood flow, and blood pressure. So we're just going to look at an overview of the blood pressure first. Just a reminder of the function of the cardiovascular system. So remember, it's there to transport things around the body. The function of the heart is it's the pump, and the function of the blood vessels, they're the transport route. So start this in your notes. It's really important to remember that blood pressure drives blood flow. So blood likes to flow from areas of high blood pressure to areas of low blood pressure. And what initially generates the blood pressure is when the ventricles contract. So that will force the blood to flow through the circulatory system and then back to the heart again. If the heart stops beating and stops contracting and pumping the blood, then the blood pressure goes almost to zero. And it would be very hard to get an IV catheter in if your patient's heart has stopped because there's no blood pressure. So blood pressure is defined as the force exerted by the blood on the vessel wall. And there are two different types of blood pressure because we have two different types of blood vessels. So we talk about arterial blood pressure and venous blood pressure. So most of the time we're going to be measuring arterial blood pressure. There are some instances when you do measure venous blood pressure, but for most of our patients we just end up measuring arterial blood pressure. And arterial blood pressure in the systemic circuit is the one that's most commonly measured because it's very easy to measure the blood pressure that's in the brachial artery that's in the arm. And that brachial artery is very close to the aorta, so that's going to give you a pretty close approximation of what the blood pressure is in the aorta. You can measure the arterial blood pressure in the pulmonary circuit, in the pulmonary artery, but oftentimes you have to do some invasive things to get that measurement, so that's not measured very commonly. So the arterial blood pressure in the systemic circuit, it does fluctuate with the cardiac cycle. So we end up with systolic blood pressure and diastolic blood pressure. Systolic blood pressure is the highest pressure, and that occurs in the aorta when the ventricle is in systole and contracting and ejecting blood out into the aorta. And the diastolic blood pressure is the lowest pressure, and that occurs during ventricular diastole when the heart is resting in between beats. The pulse pressure is just the difference between the systolic and diastolic pressures. So when you take someone's pulse, or if you take your own pulse, that throbbing that you're feeling, when the throb goes by, that's the systolic pressure, and then when the throb disappears, you're feeling the diastolic pressure. So the pulse pressure is you're just feeling the difference between the systolic and diastolic pressures. So because the blood pressure fluctuates during the cardiac cycle, we often want to determine what the average blood pressure is. So the average blood pressure in the aorta is the mean arterial pressure, or MAP. And there's some formulas here to calculate the MAP. I'm not going to ask you to do this on the exam, and that's because the machines in the hospitals will just calculate the MAP for you, so you don't need to know how to do this. But basically what the MAP is, it's a weighted average. So we're basically going to be taking 1/3 of the systolic pressure number, and then we're going to add that to 2/3 of the diastolic pressure number. And the reason we do that is because we spend more time in diastole than we do in systole. So it's a weighted average, and we're just saying that yes, we do spend more time in diastole, so we're going to give that more weight to that number and less time in systole, so we give that one a little bit less weight. So remember looking at this graph before, this is really important to understand. So in blue, we're looking at the aortic blood pressure. So notice that the highest aortic blood pressure is right here at 110, that's your systolic pressure. And then the lowest pressure in the aorta down here at 70, that's going to be your diastolic pressure. So the systolic pressure is when the ventricle is in systole, it's contracting and injecting blood out into the aorta. So that's in the ventricular ejection phase. And then the lowest of the aortic pressure, the diastolic pressure, that's going to occur during diastole when the ventricle is resting in between beats. And notice that the diastolic pressure never goes to zero. And that's because the aorta walls are elastic, and when the blood gets squirted out into the aorta from the left ventricle, it stretches the aorta walls a little bit, and then when the blood stops being ejected into the aorta, those aorta walls will then recoil and squeeze on that blood that's left in there and keep the pressure up. So the pressure never goes to zero in the aorta, which is good because then that will keep the blood flowing through the circuit, because blood likes to flow from areas of high pressure to low pressure. And then if you take a look at the mean arterial pressure, that's just our average pressure in the aorta. So we like to know that because the systolic and diastolic pressure, they will fluctuate. And so we want to know just what's the average. And notice that the mean arterial pressure, that's closer to the diastolic pressure than the systolic pressure. And that's because the heart spends more time in diastole than it does in systole. So our mean arterial pressure, we've got a weighted average, so we give more weight to the diastolic pressure. Here's some examples of blood pressure determination. So let's say that our patient, we measured the blood pressure and it was 110/70. So the 110 is the systolic pressure, and then the bottom number, the 70, is your diastolic pressure. If you wanted to calculate your pulse pressure, you're just going to take the systolic minus the diastolic pressure, and the pulse pressure would be 40 millimeters of mercury. So that just means that when you're feeling that patient's pulse, the pressure that you're feeling, that would be 40 millimeters of mercury, so that's your pulse pressure. If you wanted to calculate the mean arterial pressure, you would just put the numbers into this formula here, and notice that the MAP is around 83 millimeters of mercury. And so the MAP is going to be closer to the diastolic pressure of 70 than it is to the systolic pressure of 110, and that's because the heart spends more time in diastole. So we give that diastolic pressure more weight, so MAP will be closer to diastole. I will not ask you to calculate any of these on the test, so don't worry about that. So this is how you measure blood pressure. Some of you have probably already done this with patients. So we're going to put a cuff around the patient's upper arm and inflate that, and cut off the blood supply through that brachial artery. And with our stethoscope, we're going to listen over the brachial artery as we slowly let the air out of the cuff. And the first sound that we hear through the stethoscope, we're going to note on our pressure gauge, and that'll be your systolic pressure. And then when the sound disappears, then that'll be your diastolic pressure. So we would note that on the gauge. And so that's how you would figure out the patient's systolic and diastolic pressures. And of course, nowadays we also have automatic cuffs that you don't even have to listen with your stethoscope anymore, and the machine will just tell you the systolic and diastolic pressure.